Hello, I'm Steve Spaulding with Clearwater. Clearwater is a leading provider of HIPAA compliance and cyber risk management software and services, specifically designed and tailored for our healthcare industry. We're proud to call Nashville home, and in fact, have been doing so since our founding in 2009. We're also extremely proud to continue our long-standing partnership with Tennessee HIMSS and are honored to be a sponsor of this year's Summit 20. You know, as our industry continues to embrace new technologies and become increasingly digitized, it also becomes more vulnerable to cybersecurity attacks, as we've seen throughout this year. Clearwater's mission is to help healthcare providers and their business partners better understand their cybersecurity risk, and as such, create and implement appropriate remediation efforts for risk reduction. I hope you'll stop by our sponsor room to learn more about Clearwater and how we most support your organization. Physicians are a principal stakeholder in the digitization of healthcare, and I'm very excited to hear the insights that Dr. Jesse Ehrenfeld will share with us in the next session. Why physicians' use of digital health is on the rise. A bit about Dr. Ehrenfeld. He is the chair of the American Medical Association and is a Joseph A. Johnson Jr. Distinguished Leadership Professor at the Vanderbilt University School of Medicine in the departments of anesthesiology, surgery, biomedical informatics, and health policy. He also serves as an adjunct professor of surgery at the Uniformed Services University of the Health Sciences in Bethesda, Maryland. If that does not keep him busy enough, he also consults for the World Health Organization's Digital Health Technical Advisory Group, and he serves as a special advisor to the 20th U.S. Surgeon General. Dr. Ehrenfeld is an author, an advocate for the LGBTQ community, and a combat veteran proudly serving as a commander in the U.S. Navy. Hoorah! Dr. Ehrenfeld divides his time among clinical practice, teaching, and research. His research is focused on understanding how information technologies may improve surgical safety and patient outcomes, a most noteworthy endeavor. So without further ado, over to you, Dr. Ehrenfeld, and thanks to every one of you for joining.
My AMA moves hearts. My AMA moves minds. Our AMA moves the world.
Well, good afternoon. Thank you for joining us for what I think will be a really interesting look at technology, the future of digital health, and what's driving physician adoptions of digital health tools. My name is Jesse Ehrenfeld. I'm an informaticist, an anesthesiologist, and the immediate past chair of the American Medical Association's Board of Trustees. And I am so delighted to be able to share this presentation with you. Technology, of course, is changing medicine in profound ways. And in this time of rapid and exciting change, the American Medical Association continues to be an outspoken proponent and advocate for smart innovation that aligns with our core principles of confronting the chronic disease burden and improving health outcomes, taking away obstacles that interfere with patient care, and educating physicians to meet the challenges of giving patient care in the digital age. Now, physicians understand that to incorporate digital solutions in the clinical setting, those innovations have to be a couple of things: evidence-based, validated, actionable, and connected. And for health technology to work as it should, whether it's telemedicine, electronic health records, or AI, physicians must be involved throughout the innovation cycle, from initial design to testing and prototype development to market adoption of the new technology. So as this is our starting point for my conversation with you today, I want to give you first a broad overview of how the AMA works, and then what we're focusing on in this digital age of medicine and what's driving physicians' increased use of digital health. Now, it's a lot to cover in about 30 minutes, so let's go ahead and get started. I thought I'd begin with a brief overview of the American Medical Association and how we're structured so that you have a better understanding of how we develop policies and engage various stakeholders on a number of issues, technology and otherwise. More than 190 state and specialty organizations make up the AMA's House of Delegates. That's more than 600 voting members. That House of Delegates meets twice a year to develop policy on health, medical, professional, and governance matters, as well as the principles within which the AMA's business activities are conducted. All of these delegates are members of the AMA and have been selected by the organization that they represent. That could be a state medical association, a national specialty society, a professional interest group, a federal agency, or the AMA's member sections. Now, the AMA's 21-member Board of Trustees broadly reflects the diversity of specialty and geography that's found across the Federation of Medicine today. This is a very diverse group represented by all different backgrounds and specialties. I've had the incredible privilege of being a member of this board since 2014 and served as its chair until this past June. Now, the AMA's broad work across healthcare is focused in really three core areas: removing obstacles that interfere with patient care, driving the future of medicine by reimagining medical education, training, and lifelong learning, and by promoting innovation to tackle the biggest challenges in healthcare, and finally, improving the health of the nation by leading the charge to prevent chronic disease and confront health crises like COVID-19. Now, the delivery of high-quality healthcare is increasingly dependent upon advances in science and technology. We all recognize that today. Physicians are excited and optimistic when it comes to new healthcare technologies. We just want the tools to work effectively. And that's why the AMA has made advancing digital health a core of our strategic priorities, both in terms of the technology itself, but also around the relevant policies that support and guide digital health adoption, like payment policies, so that those technologies can live up to their potential. Potential is always a key word when it comes to new healthcare technologies, because while technology has the potential to change how we practice medicine and in how our patients experience it, without vigilance and input from physicians and organizations like the AMA, healthcare technologies will fail to truly reach that potential. They will merely be tools that are given to us instead of developed with us. Now, what do I mean by driving the future of medicine? As I mentioned, we're focused on giving physicians a seat at the table in the design and development stage of new technologies. One way we're doing this is through Health 2047. This is a business development company which we founded in Silicon Valley in 2017. Health 2047 brings together a network of innovators, corporate partners, and AMA members from across all of medicine to identify critical health issues and develop solutions with the goal of spinning off these solutions as independent companies in 4 key areas: to enable data liquidity, realign healthcare systems to better manage chronic care, radically enhance productivity at all levels of care and support, and facilitate the transition to value-based payments. They've already spun out several companies. Akiri, launched last year, is developing a cloud-based framework to promote data liquidity and facilitate the secure movement of health information. First Mile Care leverages the power and convenience of today's on-demand economy to improve the lives of people living with chronic disease. It brings the Uber model of diabetes prevention to life, giving people 24/7 online access to certified peer coaches in their communities to help them get the support that they need to live better. Zing Health is a Medicare Advantage plan geared towards those who are underserved by existing health insurance plans. And it's got the flexibility with technology as a backstop to address specific patient circumstances outside the clinical setting. Now, another connection point for physicians and innovators is the AMA Physician Innovation Network. This is an online hub, free to anybody to join, where physicians can collaborate with tech entrepreneurs on creating the next digital health breakthroughs. More than 11,000 users have already connected on our online website to share their clinical expertise or advance a digital product with help from leading physicians across specialties. If you haven't checked out the Physician Innovation Network, I encourage you to do so. It's free and open to everyone. Of course, no organization can take on the challenges in healthcare today alone. And that's why we're collaborating with some of the top stakeholders in business, technology, healthcare, and academia on broad solutions that will improve the clinical environment, but also, and most importantly, patient outcomes. And you can see here some of the partners that we have engaged with currently. So now in the balance of my time, I'd like to turn to the focus of my presentation, the research that the AMA has undertaken to understand physicians' motivations and requirements for the adoption of digital clinical tools. I'll cover here what we've learned and how these motivations and requirements have changed over time. Now, in 2016, the AMA conducted a comprehensive study of physicians' motivations and requirements for the adoption of digital clinical tools. In 2019, we repeated the same study to determine the degree to which adoption had occurred in the past 3 years and to look for attitudinal shifts among physicians towards their use and adoption. The goal for this research were to determine a couple things. One, were there changes in the overall interest in digital health tools and the degree to which physicians believe they will help or hinder their patient care? Two, to create an understanding of the current familiarity with 7 very specific digital health tools and understand physician enthusiasm around those tools, understand the belief in their relevance to their practice, as well as what the timeline might be for incorporating the use of those tools if they're not already using them. For each of those tools, we looked at the motivators and level of disruption that has been caused or foreseen by adoption, the ideal level of involvement physicians would like to have in adoption decisions, as well as finally an understanding of the enthusiasm, current usage, and requirements for a variety of emerging technologies. And I'll cover the results of all of this in the balance of my talk. So the survey was designed in 2019 to replicate the survey that we did in 2016 so that we would have a statistically valid and reliable comparative sample. The same physician panel was used in 2016, one that was provided by WebMD, which is a key partner for us. 2019, the survey was slightly longer. We had 18 rather than 15 minutes, but new questions were added to the back of the survey so that we wouldn't interfere with the flow of the original questionnaire and impede the availability of our analysis on the results. The basic 2016 survey was followed exactly in wording and question order, just a few variations to remove some small questions that were frankly no longer relevant. And the sample used careful quotas to ensure very similar sample compositions of the physicians interviewed that we had in 2019 as in 2016. So here you can see we had 1,300 physicians in 2016, 1,359 in 2019, and a roughly equal split of primary care physicians, specialists, those in solo practice, in group practice, or another care arrangement. Okay, now the survey instrument itself, we start by defining what do we mean by digital healthcare. We use the definition that digital health encompasses a broad scope of tools that engage patients for clinical purposes, collect, organize, interpret, and use clinical data, and manage outcomes and measures of care quality. This includes, but is not limited to, digital solutions that involve telemedicine and telehealth, mobile health, wearables, remote monitoring, and apps. And within the survey, we talked through the use of 7 very specific tools: remote monitoring for efficiency, televisits or virtual visits, remote monitoring and management for improved patient care, point of care or workflow enhancement, clinical decision support, consumer access to clinical data, and patient engagement. The questions that we walked through with all of our physicians in the survey started with some questions about their overall involvement in digital health. How does it impact their ability to provide care? What are their motivators and the functional requirements to use these tools? Then we got into details about the specific digital tools that I've just outlined, looking at their familiarity, current use, relevant to their practice setting, enthusiasm, timeline for incorporation, and ideal level of involvement in digital health in general. And then we went into some individual tool deep dives, and we asked them to talk about 2 relevant solutions to their practice that they weren't currently actually using. Now, the 7 specific tools about remote monitoring for efficiency, for improved care, clinical decision support, patient engagement, televisits, point of care workflow enhancement, and consumer access to digital care are defined here. And if you're interested, again, we'll make these slides available to you afterwards. So I'll give you the bottom line first. This is the summary of the changes that we found in 2019 from 2016. 4 things. First, there's been an increase in the number of physicians that see a definitive advantage in digital tools. The growth in those that see advantage is most high among primary care docs, and those that see no advantage are trending downwards and are concentrated in the 50+ age segment. The second finding was that adoption of digital tools has grown significantly among all physicians, regardless of gender, specialty, or age. The use of 7 tools has increased, all 7 of them. There's been increased efficiency and patient safety as key drivers, and tools need to be covered by standard malpractice insurance and have data privacy concerns increased if there is going to be further adoption. Adoption of remote care tools such as televisits and remote monitoring had the most movement. Here, providing remote care to patients has significantly increased as the driver of adoption of digital tools. The use of these tools is still at roughly a quarter of physicians, but this has nearly doubled from 2016, and the likelihood of adoption has increased significantly. The fourth and final key finding is that awareness of the most emerging technologies such as artificial or augmented intelligence is fairly high. Current adoption of these technologies is very low, but intentions to adopt these emerging technologies is very high and aggressive timelines are planned. And remember, this study is before we've gone through the experience of COVID-19. So, what are physicians' motivations and requirements for adopting digital health? This shifts from 2016 to 2019. There has been a small but significant increase in the advantage that physicians feel digital health solutions bring to their ability to care for their patients. Again, the most notable increases are among primary care docs, with specialists moving slightly. Those that see no advantage are trending downwards and are mostly concentrated in the 50+ age segment. And here you can see this broken down by total physicians on the very left-hand side of the screen who see some advantage, definitive advantage, no advantage, or a mix. And then you can see the results disaggregated by specialty as well as by physician age on the right-hand side of the screen. Now, the use of digital health tools has also risen significantly. Televisits have seen the greatest growth, doubling in 2019 since their use in 2016. And I can guarantee you that if we did this survey today in the middle of COVID-19, that we would see an exponential increase from what we found in the survey. You also see increases in remote monitoring for efficiency, remote monitoring for improved care, clinical decision support use, patient engagement tools, point of care workflow enhancement tools, as well as provision of consumer access to clinical data. The average number of digital tools has also gone up. Now, older physicians and those less enthusiastic about technology, and there's a lot of overlap, are starting to catch up in their use. And here you can see the average number of digital tools currently being used on the left-hand side of the screen overall between 2016 and 2019. And then you can see a breakdown by physician age, by physician gender, years in practice, and overall enthusiasm for technology, where there are some interesting differences in that there have been more significant rises in older physicians, there have been more significant rises in female physicians, more significant rises in those who are longer in practice, and those who are skeptical about technology. Now, what about solo practices? The use by solo practice physicians and partial owners of solo practice of these tools has also increased. And these physicians had been lagging behind other physicians in 2016, but the solo practice docs are now getting closer to the average use of technologies. And you can see, again, these results disaggregated by ownership of practice type, by practice size, by practice setting, whether they're medical school faculty, part of a multi-specialty group, a hospital, single specialty, or solo practice. and then finally practice type, whether they're a primary care doc or a specialist. And again, what we're seeing is that solo practice physicians and partial owners are starting to catch up to the rest of the pack. Now, while all digital health tools have seen increases in adoption since 2016, the remote care tools have seen the biggest moves forward. And again, this is pre-COVID. What we've seen is a huge jump in the percentage of physicians who are currently using tools for virtual visits from 14% to 28%, as well as a huge jump in the number of physicians that are using remote monitoring for improvements in care from 13% to 22%. Remote care tools are also going up with the highest likelihood of adoption within the next 3 years. And so when we ask physicians, do they use or currently plan to use to understand their adoption plans, what we're finding is that there's the largest jump and the highest likelihood of adoption of remote care tools within the next 3 years, particularly amongst those that are likely to adopt sooner rather than later. Now, providing remote care is also a driving force for adoption and the only motivator that has seen upward movement in the past 3 years. So here we ask, what are the things that are very important, somewhat important, or not important to the adoption of a variety of technologies? And what we found is that physicians who find that something is going to allow them to provide care to their patients remotely are much more likely to use that as a motivator to adopt a technology. And that's the single thing that's really changed in this bucket of drivers more so than anything else, like having new streams of revenue, allowing patients, more patients to be seen in a practice, improving resource allocation, or even patients demanding it, which was a little surprising, I think, to all of us. Now, when asked about what digital health tools physicians are most enthusiastic about, remote tools are the two that gained the most traction since 2016. And here we asked the percentage of physicians to tell us where they had their most enthusiasm. And we found it was most increased amongst those who thought televisits and remote monitoring and remote management for improved care would be drivers of their adoption. Now, multi-specialty groups, not surprisingly, are currently the heaviest users of remote digital health tools. However, there are other groups that have showed relatively heavier usage of remote digital health tools, and those include hospitals, physicians under 50, and primary care docs. And you can see that here on the slide where we disaggregate who's using virtual visits by age, as well as practice setting, and then who's using remote monitoring for improved care by specialty type, as well as practice setting. Now, it looks like, according to our survey, that improved efficiency and increased patient safety remain the top motivators for physicians to use digital health tools, where we found that 51% of physicians saying that they thought that improving efficiency was the most important driver. We saw a huge shift in the number of individuals who reported that tools that would address burnout. And then you can see the rest of the items on the left-hand side of the screen. There has also been a significant shift in the importance of remote care. Here we asked questions about the importance of whether these tools allowed patients to be cared for remotely, resource allocation, see more patients, new revenue streams. And what we found is that, again, there's this really interesting shift in that practices really are using these tools to be able to deliver care remotely as a driver of adoption of these tools. Now, two elements that attract physicians to digital health tools have shifted in their overall importance. And those two are that they allow me to provide care remotely and they help reduce my stress and burnout. They have gone into the quadrants for drivers, now closely hovering along the line between key motivators and secondary drivers. And while those shifts are small, they are meaningful and statistically significant. And so again, what you can see on this graph is the level of importance on the x-axis from low priority to being a higher priority and a secondary motivator. And then on the y-axis, how individual things are being ranked. And so that allows us to understand are things and motivators really kind of a low priority, a niche need, a key motivator, or a secondary driver. Now, the requirements for adopting digital health tools have really remained unchanged. Integration with EHR and being as good as traditional care are really the two key requirements that physicians continue to report them wanting to have before digital health tools will be adopted. The importance of digital health tools being covered by standard malpractice insurance has increased significantly as a requirement. And we think that this shift going from 52% thinking it's very important to 57% thinking that it's very important is likely because of the recognition that malpractice coverage is a significant issue for technologies of a variety of sorts in general. The demonstration of safety and efficacy in peer-reviewed publications has also increased in importance from 2016 to 2019. And you can see that in the sort of second grouping here, where it was 32% and 39% of physicians found it very important or somewhat important in 2016. And in 2019, it's 36 and 41% respectively. The degree of responsibility that physicians desire to have in the adoption of digital health solutions in a practice has not changed. Physicians still want to be part of the decision-making process, and owners are expected to be responsible. And here you can see that physicians overall on the left-hand side of the screen, not much change between 2016 and 2019. And then you can see the breakdown between PCPs and specialists, and then by practice ownership type on the right-hand side of the screen. What about combined use and plans to use digital health tools in their practice? The current or planned future use of digital health tools is also slightly up. Most of the growth is in televisits or virtual visits and remote monitoring for improved care. And here you can see how those adoption changes around the physicians who plan to use these tools either within a year or beyond a year, going up significantly from 2016 to 2019, as is circled on the slide. So let me now shift to talking about our findings in the emerging technology space. So these are the technologies that physicians are aware of. They don't see as being part of standard practice or things that they're ready to adopt, but they want to adopt in the future. So awareness of augmented intelligence technologies is very high, though adoption remains in the single digits for almost all tools. So here you can see the percentage of physicians in our study who are familiar with and using advanced technologies. So the purple bars are, they know about the technologies, and the red bars are, they're currently using technologies. So lots of physicians, 78%, know about augmented intelligence. For health administration, for clinical applications, 76%. They know about precision personalized medicine, 76%. They know about AI for business operations, 72%. AI for population health, 72%. AI for research and development, 60%. Or blockchain is where the lowest number was, 46%. But you see very, very limited adoption across the board. The intentions to adopt AI within the next 3 years are very high, even though current use is low. And so what's interesting here is that 1/3 of physicians plan to adopt most of these technologies within the next year, which is pretty striking given that almost no physicians are actually using these in practice today. So a very aggressive adoption timeline. Physicians are also most interested in these emerging technologies to help them serve chronic care patients. And so when we look at the markets that physicians want these new technologies to serve, you can see in the purple bar, chronic care patients, in the red bars, millennial patients, in the green bars, patients who work or who live in low resource environments, and then in the yellow bars, aging population. And again, a little surprising to us, but given the complexity of patients with chronic care and the number of resources that they use, it starts to make sense when you step back and think about it. Now, I thought I would end by saying a few minutes about how the AMA is thinking about digital medicine and payment and adoption, because those things often go hand in hand. So digital medicine presents an opportunity to improve access and to offer cost-effective medical care to a large swath of patients with diverse needs. But increasing coverage requires a concerted effort by knowledgeable professionals, as well as input, such as what are the pertinent use cases and the clinical data that demonstrate the efficiencies and clinical benefits of digital medicine. So the AMA has convened something called our Digital Medicine Payment Advisory Group, or the DMPAG, for a number of years now. And that group has been really instrumental in addressing these issues. This is a cross-enterprise group at the AMA focused on integrating digital health technologies into clinical practice. We focus on coding, coverage, pricing, and program integrity issues that are all specific to digital medicine. This group has worked with our CPT editorial panel on coding solutions, which have resulted in new codes for things like remote monitoring, internet consultations, and e-visits. Areas of focus for this advisory group include creating and disseminating data to support the use of digital medicine technologies and services in clinical practice, reviewing existing code sets with an emphasis on CPT, and determining the level to which they are appropriately capturing the same thing in the current digital medicine service space, assessing and providing current clinical guidance on factors that impact the fair and accurate valuation for services delivered via digital medicine, providing education and clinical expertise to decision makers to ensure that widespread coverage can exist for digital medicine. So things like telemedicine and remote patient technology, including greater transparency of the services covered by payers and advocacy for enforcement of parity coverage laws, which is an important aspect for us. And then finally, reviewing program integrity issues, including but not limited to appropriate code use and other perceived risks unique to digital medicine. So I want to end by providing, again, another quick summary of the changes that we've seen from 2016 to 2019. This is a repeat slide. There's been an increase in the number of physicians that see a definitive advantage in the use of these digital tools. Adoption of these tools has grown significantly among all physicians, regardless of gender, specialty, or age. Adoption of remote care tools has, such as televisits and remote monitoring, have the most movement. And finally, awareness of emerging technologies. AI is fairly high, and there's a fairly aggressive timeline planned for the adoption of emerging technologies. Thank you again for the opportunity to be here today with you virtually and to share some of the work that the AMA has been engaged in around understanding how physicians' use of digital technologies is shifting and how we can work together as partners and collaborators across the entire ecosystem to create a more effective and impactful future of technology in healthcare. Best of luck to y'all.